Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to Reasons We Smile. I'm Dr. Kvitko. Thank you so much for joining me. It's episode 621. And today in the studio with me is my new associate, Dr. Mark Pagano. We had him on by phone a couple weeks ago, and now he's actually live in the studio. So no vacation today, right?
No vacation today, no.
You were in New York City, right? Having fun?
Yep. Yeah.
Okay. So before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to our office Facebook page and like us, that would be awesome. It's Dr. Kvitko and Associates. All right, in about 10 minutes, you're going to have a chance to win free flowers from DeSantis Florist. They're going to be delivered to your place of business on Tuesday afternoon. And if you want to pre-program that phone number into your phone right now, it's 614-459-9769. That's 614-459-9769. So just go ahead and have that ready. And the question is going to be simple, it'll be obvious, and it's going to be about our guest. Okay, so let me go ahead and read you. I did this a couple weeks ago, but for those of you that weren't tuned in or not paying attention, I'm going to read you Dr. Pagano's, I guess you'd call it his CV, right? Okay, So Dr. Mark Pagano has been an Ohio resident all of his life, growing up in Canfield, Ohio, before settling down in Columbus for both undergraduate studies and dental school. Dr. Mark graduated magna cum laude from Ohio State University with an honors diploma in biology and a minor in Spanish. In 2018, he earned his DDS from the Ohio State University College of Dentistry and graduated in the top fourth of his class, earning the Dean's Excellence Scholarship. Dean's Excellence Scholarship for the top 10 applicants in his class upon admission. Wow. Dr. Mark spent his days in dental school helping plan the Anatomy Memorial Service for donated cadavers for all professional schools, helping with OSU College of Dentistry's admissions interviews for incoming applicants, volunteering around the community in understaffed Medicaid dental offices, and volunteering in various elementary schools to teach young kids in underserved areas about the importance of oral hygiene. Now, Dr. Mark has been out of school for a year and a half, and he's excited to diversify his portfolio and skills to become a well-rounded practitioner. So, Dr. Pagano, welcome.
Thanks for having me again.
Thanks for getting up early again. But anyway, hey, how about those Bucks? We won, the football team won, the basketball team won. You got to go to the game?
Yeah, it was exciting. That was my first game I've ever been to live.
Really?
Yeah.
Okay, and this is your second show doing live.
This is my second show doing live, yeah.
Things are looking up, right?
Yeah.
Okay, so I'm excited to have Dr. Pagano. I want to introduce him to you guys so that if you choose to come to us, you'll know what to expect, and maybe already feel like you know him a little bit.
Yeah.
So we talked last time about this, but I talked about how having the gross anatomy class and the cadavers, being able to work on them was so valuable. Mm-hmm. And I was so appreciative of the people that donated their bodies to science, and forgot to make the connection that you also are involved in that, making sure that the bodies get a proper burial, right?
Mm-hmm. Yep. Every single body that was worked on at OSU through all professional schools, not just dental school. I was involved in making sure that they had a proper ceremony, so we invited all of their loved ones, so they got to actually have a proper ceremony, because what you don't realize is that, a lot of these bodies, they don't get to have proper burials because we're working on them. And so a lot of these people don't really get that full closure until like a year or so later. And so, we were responsible for bringing them all together in a big ceremony. It was at the Ohio Union on campus, and it was a really beautiful moment. It was probably one of my favorite moments of all of dental school for sure.
Well, now, while I was working on the cadavers, I didn't know their names. Did you know their names or not until after?
No, I actually never knew their names. The only time I actually heard their names is during the ceremony when people
wow.
would come up and would kind of like say who their loved one was and would kind of tell a story about them.
Wow,
Yeah.
wow. That's really special, so I
Yeah.
want to commend you for that.
Thank you. I appreciate
I think
that.
a lot of professional students take that kind of for granted and don't realize, but
Yeah.
I think we all appreciate what those folks have done. So if you're thinking about donating your body to science, this is good information because you know that you're not going to be forgotten, it's going to be well taken care of, and there will be a ceremony.
Yeah, no, the loved ones were very appreciative too. There was, a lot of tears, a lot of, happy tears, good memories being shared. So it was a really special moment. I truly was probably one of my favorite moments of dental school.
Okay. So that'll lead me to my next question, which is, what do you like most about being a dentist now that you've been a dentist for almost 2 years or a year and a half?
I would say just getting to see more patients, kind of, getting more in the community more and, getting to know more people. You get to just transform more smiles, I would say, you get to actually see more of your work out in the real world. And I think that's kind of, a really cool part about it.
So you're walking in the grocery store and you see
And
a person, you go,
I'm like, that's a
I
Mark
did that
Pagano
crown.
work. Yeah.
I did that smile.
Yeah. I'm sure that'll eventually happen after a couple more years. I'm sure that's something that you experience a lot, though.
Yeah, because if I don't say it out loud, I'll kind of whisper to my wife. So what do you like the least? I know this is a loaded question. I'm not sure we really want our patients to know what we don't like about our job, but I think it's a fair question because everybody, even those who love their job, have a few things that are their least favorite. We'll call it your least favorite, not what you hate.
Okay, yeah. My least favorite. Oh, that's a good question.
And if you're not ready, I'll tell you a couple of mine.
Okay, yeah, give me a
Okay, and
couple of
while you're
years.
thinking about
Yeah.
it. So my least favorite thing about being a dentist is having to deal with insurance companies and
Oh, yeah,
having
that
to
was-
deal with the patient's misunderstanding of their insurance.
Yeah. I was going to say something like that as well, just how, different every single insurance company is and, some things won't qualify and you feel like, well, I used to work at a Medicaid practice before this. So like, it's hard to want to recommend certain treatment, but, Medicaid only lets you do certain procedures. So, you want to try to, give them the best treatment plan you can. And you do present that to them because, as you ethically should, but you're kind of limited by what they let you do.
And that's Medicaid, and you would expect that to be maybe lesser because it's supposed to be kind of a stopgap while people are maybe unemployed they're between jobs, something bad has happened, and now they need government help, but it's not designed to be, quote, dental insurance.
Yeah.
But with real dental insurance, that's where it's very frustrating because it never works like insurance.
Yeah. Yeah. No, I agree for sure. Let's see another one. You get some bad breaths in there. I would say that's a pretty good one.
You know what? Yeah, I hadn't thought of that.
Yeah.
I have kind of a big nose, but luckily I don't have a great smeller.
Oh, really?
Yeah, I'm not offended by very much. I don't know if my nose is that bad or people aren't, they're remembering to brush or something. But I'll tell you what, my least favorite odor is minty onion breath.
Minty onion breath.
Because people think they can go and have like a big old onion burger at lunch, just put little tiny mint in their mouth, come for their
minty
dental.
onion breath. Okay,
Yeah,
I get
minty,
it.
and come for their appointment, and this all I'm going to smell is the mint. I don't say anything, but yeah, minty onion breath.
Yeah, or the perio breath. That's a pretty good one that you'll smell.
For those of
often.
you that don't know what that is, perio breath is just a little phrase we use for somebody who has periodontal disease, and a lot of people don't even know they have it. Most people don't. And so, our sense of smell is gets tired very quickly. So people don't smell themselves. You don't know you have BO. You don't know that you have bad breath. And so when you have severe periodontal disease, there's this distinct odor that you have, and it's the same as everybody else that has it.
It's very distinct.
Yeah, and it's almost like, for me, a diagnostic tool. If they come up and say, "Hi, I'm so-and-so, nice to meet you," and they have perio breath, then I know I'm going to be talking to them about periodontal surgery.
Yeah, no, yeah, I agree. Yeah, I remember at the beginning of dental school, they said, once you smell it, you'll know for the rest of your life.
A little bit like weed, right?
Yeah, right.
you
No,
smell
for
it.
real. Yeah, nothing else smells like it.
Yeah, exactly. Yeah, or that smell of natural gas that they put in to make it smell, so we all know that there's a gas leak.
Oh, yeah.
That's
Not
very
too.
distinctive too.
Yeah, that's a good one too.
So anyway, yeah. So for me, it's the least thing that I like about being a dentist is people having to deal with their insurance companies and my staff and all of that. And but if you're a patient and you would just say to yourself, okay, I need this care. My insurance company's going to help me a little, but but I'm not going to let them dictate what I get because they're not paying enough of the bill.
I agree.
You'll be healthier and happier.
Yep, I agree 100%. Yeah.
Okay.
Oh, I know another one too.
What?
It's also pretty hard to see, to work on little kids who kind of have, bad teeth, whether it's through,
sad,
their
right?
parents neglecting it. Yeah, that really sticks with me for a while too, extracting permanent teeth on like a little kid because you might not have any other choice.
Right. And so parents, keep in mind that even though it's 2019, going to be 2020 real soon, well, there is still tooth decay. And kids can't brush very well. They don't have the manual dexterity. In fact, until they can tie their shoes 6 times in a row, they don't have the dexterity to properly clean their teeth.
Oh, wow.
So just because you're brushing yours and you're a good mom or a good dad and you're doing all kinds of nice things for your child, you have them in gymnastics, you have them in dance, that doesn't mean they're not getting cavities.
Yeah,
you know what I mean?
It's true.
There's this sense that I do everything right, so my kids should be healthy, but make sure you have fluoridated water. If you are a parent who has a water filtration system, you're probably filtering out the fluoride, and your children are going to get cavities. Yeah, people don't realize that. They forget.
Even a Brita system would do that?
Yeah, Brita does it. If you buy bottled water, all the fluoride's gone.
Bottled water, yeah.
Bottled water, it's gone, and the Brita systems, it's an ion osmosis type thing, right?
Okay, yeah.
It takes out the ions.
Yeah.
Well, fluoride is an ion.
Yeah, I didn't think, that's interesting. I didn't think the Brita filter would do that.
Yeah, so just, give them tap water.
Yeah.
Mix up the Kool-Aid, mix up the lemonade, whatever the formula, whatever you're mixing up, make sure you're using tap water. Okay, so what's your favorite procedure to do?
Ooh, I think I really like doing crowns. I think that's my favorite procedure to do. Just because you really get to see, a nice full new reconstructed tooth, especially in the anterior or in the front of your mouth, working on like cosmetic smiles. I think that's probably my favorite just because, patients react the most to those often, besides, when they're in pain and you get them out of pain. But the next thing they'll, really react the most to is, seeing it in their front tooth, seeing it in the front of their mouth and really liking the appearance of it.
Okay, so enhancing their smile, basically.
Yeah, enhancing their smile.
Or just making one tooth blend with the other 5 or 6.
Yeah.
Okay, which is really tricky, folks.
Yeah, what's your favorite?
My favorite thing to do? You know what? Looks like it's about time to go to a break, so we'll hold that. That'll be our teaser. How's that?
Right, that's a good cliffhanger.
So when we come back, we're going to find out, after Dr. Kvitko's question of the day, we're going to find out what my favorite thing is to do. But remember, you're going to have a chance to win free flowers here soon, but before we do the contest, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, and remember, you're going to have a chance to win free flowers from DeSantis Florist. I'm going to give you the phone number now, so you'll be able to get it ready to push send, 614-459-9769. Okay, so today we are speaking with my new associate, Dr. Mark Pagano. Which of the following describe what he did as a dental student? A, he helped plan the anatomy memorial service for donated cadavers for all professional schools. B, he helped with the Ohio State College of Dentistry admissions interviews for incoming applicants. C, he volunteered his time in local understaffed Medicaid dental practices helping with patient care. D, he volunteered in local elementary schools teaching young kids in underserved areas about the importance of oral hygiene. Or E, all of the above. All right, winner's going to receive those free flowers from DeSantis. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hey, what's going on? It's Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. You can look for my smile courtesy of Dr. Kvitko on the CBS television network, where I play Danny on the hit soap opera The Bold and the Beautiful. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. Okay, we're back. We're doing Dr. Kvitko's question of the day. We have Tiffany on the line. Hi, Tiffany. How are you?
I'm good. How are you?
I'm great. I'm great. So, what is the answer to Dr. Kvitko's question of the day?
It is E, all of the above.
Yes, yes. Tiffany, what do you do for a living? I always ask my callers.
I work for transportation with the schools.
For schools? Oh, like making sure the school buses get where they need to be?
I'm a driver, yeah.
Oh, you're actually a driver. So you drive a 45-foot bus or something?
Yeah.
You know, how come there's all these women driving school buses, but I can't get my wife to drive my motorhome?
I don't know, but I'm sure it would be fun.
Anyway, all right. Hey, Tiffany, stay on the line, right? We need to get the information where to send those flowers. And
okay.
Thanks for listening. And those of you that didn't win, to call next week, okay? All right. Okay, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 621. In the studio with me, I'm moving the Facebook camera there, is Dr. Mark Pagano. He's our new associate. We're happy to have him. He's blending in really well, and we're, making sure we put him to work.
Yeah.
So if you want to make sure he's not sitting around doing nothing, you guys need to call the office and ask for Dr. Mark. It's 614-262-9588. All right, so in our effort to get to know you a little bit, oh, that's right, before the break, you asked me a question. You're not supposed to ask the questions. What's going on here? That wasn't in the cards. Okay, I'll tell you what, I have several, but probably the most rewarding is a smile makeover. Mm-hmm. Now, that takes several weeks or months.
Yeah.
But that before and after, and I've shown you several of them.
Amazing
and you can
results.
tell that I'm proud of that. And this, what it does for a person's life is just like night and day. The way you're perceived. You know, I use this as a serious example because they're all different. There's a gradient of how much your smile is going to help you in your life. Mm-hmm. But if you want to just take the extremes, you have Billy Bob teeth, you're not getting a evening news anchor job. Mm-hmm. You're not going to be the weather girl. I mean the traffic girl or the weather person, right? Mm-hmm. There are a lot of things you can't do with Billy Bob teeth. Yeah. You're just not eligible. Yeah. You won't even know why you didn't get the job or why you didn't, I remember watching American Idol, and one of the really, like the finalists, one of the 8 contenders, all people talked about was how his teeth were all jacked.
Oh, wow. Yeah.
Didn't win. Yeah. Now, I also saw that he went to a dentist and got them all fixed, too.
Right.
Can't remember his name right now. But the other one where there's this immediate satisfaction and gratification is getting somebody out of pain.
Yeah. Mm-hmm.
Especially a new patient. They come in. They're usually a little bit standoffish, almost like curmudgeon, not quite mean, but curmudgeon type personality.
That's a good word for it.
Yeah. Mm-hmm. And but the minute you get them numb, get them out of pain, this beautiful person comes out.
Yeah.
You know? Isn't that neat
to
be able to have the power to do that?
Yeah. Mm-hmm.
There aren't many people that can. think about that. Physicians don't get to do that half as much as we do.
Yeah, see that immediate relief from them.
Yeah.
On their patients.
Yeah.
No, that's amazing.
So-
Yeah, I also do like one procedure that I do like. I mean, I don't like doing it from a professional standpoint, but extracting teeth, there's something satisfying about being able to get it out. I don't know. People always ask too, what's it like pulling a tooth out of somebody's mouth, and sometimes they can be a little challenging, and people don't understand that because they probably hear that old adage that you can tie a string, and just hook it up to a door. But there actually can be a little challenging. So sometimes you work on it for a little bit, and that feeling of just seeing it come out, there's something satisfying about it.
Got it all out.
Yeah.
Right. And people, you can't extract your own teeth. Don't try. You might think you got it out.
Yeah.
I actually watched a YouTube video of this guy who had got himself stone drunk trying to pull his tooth. And well, let's see, what was he doing? He was sitting in his car using the rearview mirror and had a camera next to him. And to me, it just sounded like or looked like he was trying to be the big tough guy. I can't afford to get my tooth extracted, so I'm going to do it myself.
Yeah.
Let me just videotape it so that you guys all know how tough I am, right? And so he reaches in with some clean, brand new pliers that he bought, and he pulls out this little piece. We know what he pulled out was just a little sliver of tooth above the gum line.
Did he think he was done?
Yeah. and he takes a Kleenex tissue, out of the glove box, and it's got a tiny little drop of blood. If you're taking a whole tooth out, you're going to need several of those tissues.
Yeah.
And it's going to be a big, big thing in your hand. So it's the old that movie Castaway where Tom Hanks took a figure skate and supposedly extracted his tooth with the toe pick.
Yeah.
Doesn't happen.
Yeah.
You can't do that. All they did was split his tooth and make it worse. And in the movie, the way they dealt with it is he just blacked out, and then who knows how many days or weeks later he woke up.
Oh, yeah.
They didn't really deal with the pain he would have been in. And he wouldn't have blacked out for very long. He would have just been in pain for the next month, probably.
Yeah, I think so.
Or longer. So don't do that. Don't ever,
No ice skate extractions.
Yeah. So it kind of looks like it's time for us to go to another break. You're listening to The Reasons We Smile. Here in the studio with me is Dr. Mark Pagano, episode 621, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
Okay, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. In the studio with me is Dr. Mark Pagano. He's our new associate, the future of Dr. Kvitko and Associates, apparently. At some point, it'll probably drop my name and it'll just be yours, I'm thinking.
Or we can combine them.
Or maybe we're, Pagano. Or Kvitko.
That sounds better. A little easier on the ears.
Anyway, okay, so what we're trying to do is get to know Dr. Pagano. Goes by Dr. Mark in the office. And so now I wanted to mention you've signed up to become certified in providing intravenous sedation.
Yeah, I put the deposit down the other day, so it's happening.
And when will that be?
January 13th.
January 13th.
It'll be a week training. I'll be gone the whole week, so I won't be in the office for that week.
Okay. So my question is, why are you getting this training and certification? I know the answer. I just want people to hear it.
I feel like it just really opens up my possibilities as a provider. A lot of people are really afraid of the dentist, obviously, as a lot of
heard
people
that?
Yeah,
They tell you
that's
that
a
in dental
rumor
school.
out there.
It's a rumor.
And it's just, working, you truly do see the fear in a lot of people's eyes when you're working on them. And a lot of people just, will ask to be, put under so that, they don't have to deal with, hearing all of the noises that happen when we're working and, dealing with, any kind of fear that they'll be experiencing during the procedures. So I want to do it so I can, make people feel more comfortable because, that's what's really most important is making sure everybody has a really good experience while they're there. And, if some people, want to be, put out for procedures, then I think that's something that I want to be able to provide. And Dr. Kvitko has been doing it for a lot of years. So I think.
Yeah, I started doing it in 1985.
1985. He basically wrote the book on it.
There's that side story, right?
Yeah.
So, yeah, in fact, we did, and it's not just IV, but once you have your IV sedation permit, you're also permitted to do more oral sedation, change the dose a little bit. You don't have to send them home if you guess wrong. There's such a big advantage to it. But the other is sometimes people, they don't want the IV, they want it, but they don't want to have to pay for it. So they say, can we just do oral sedation? But we have the ability then, we can say, okay, we can do that. And if it turns out to be not enough, do we have your permission to do IV sedation? And that happened, I think, was it last week, Monday or something? Or was it the week before? Yeah.
I think it was Monday, yeah.
Yeah, we gave her, we had all that discussed and we gave her the oral sedation and we're kind of getting ready. She goes, this isn't the state I want to be in. Just go ahead and do the IV. So we did. And, she was completely out. When I say that, I mean unaware. And then on, I think it might have been Friday, just 2 days ago, we did an oral sedation on a woman. She's a nurse, very nervous about dental care. I think she's nervous about a lot of medical care. Could be that she knows some of the backstories that we don't know, and like that commercial for the doctor who just got reinstated, and he walks into the room. Do you know Dr. Francis? And she goes, "Oh, he's okay." Have you seen that commercial? Oh, you haven't? Oh, it's okay. You haven't been watching enough TV. Or I've been watching too much. But anyway, this guy, she's going, he's okay. And he got like, just okay? This guy's getting ready to operate on my husband, right? So anyway, so she's a nurse and she kind of deals with that every day. So she's kind of terrified. But we used oral sedation. Our first dose wasn't quite enough. We added a little bit in, which you can only do if you have an IV sedation permit. Got her into a nice state. And when I talked to her the next day to see how she was feeling, she said she was not very sore. We did 2 gum grafts. She wasn't very sore. She said, I'm actually out shopping. It was a much better experience than she had anticipated, and she thanked us very much. And that's what you get when you can sedate people. It's not always knocking them out, but it's being able to make them comfortable, right?
Yeah, no, that's the best part about it.
And I've built my practice on making people comfortable and trying to make the practice successful. There are offices that have named themselves, soft, gentle, caring, blah, blah, blah. But the name doesn't really cut it if they're not gentle when you get there.
Yeah, no, exactly. Yeah.
And I've had some people come to me from an office that has the word gentle in it, and they said they're not gentle. So, and so, it's something that we live. I've always lived it at my office, and it's nice to know that you want to continue that.
Yeah.
Because if I happen to be sick that morning and you were scheduled for an oral sedation, well, Dr. Pagano will be able to do it.
Yeah.
So anyway, no, that's really good. I applaud you because I've had several associates over the years, and not one of them actually pulled that trigger.
Oh, really? Am I the first?
They all said they wanted to do it.
Oh, that's kind of cool.
Yeah, it is very cool, more than you realize, because they just didn't, you know? So... Gee, I think I'm looking at the clock, and I think I'm about to get that sign from my producer, which is time to shut up, Dr. Kvitko. He can't say that out loud. He just thinks it. If you could see his face, you'd know what I'm talking about. Okay, so I guess we'll have to continue this, right?
Yeah,
in another few weeks or so, or whatever.
I think I'm a radio personality.
There you go. Yeah, that's right. People will want your autograph. I'll tell you what, he has a face for TV, not for radio, though. All right. Okay, so that is all the time we have. I want to remind you, if you want to follow me on Twitter, it's at Dr. Kvitko. If you please go to my office Facebook page and like us, it's Dr. Kvitko and Associates. I guess I should say our Facebook page. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email